So, hi, my name's Dr. Frank Corriliano. I'm a clinical psychologist and I specialize in telemental health. So I have a couple projects going on. I'm also a member of the New York Society for Ethical Culture, which is where you are. The New York Society for Ethical Culture is a faith-based organization, an educational organization. The faith is in creating a more ethical society, and the mantra is deed above creed. So it's more about doing good now and creating a more ethical society as contrasted with maybe doing good now so you go somewhere after or don't go someplace after. So it's a really cool place. We get a lot of great creative intellectuals, and we have a long history of social justice things. So a couple of things I just want to point out, and over the next week we'll get to know each other, but I want to give you a little bit of information. There's a brochure about the ethical culture that's on the back. You can grab that. There's also the Social Service Board, which Dr. Phyllis Harrison Ross is the chair of that, and she's really the lead push behind many of the initiatives based on social justice, mental health, and using technology to address clinical and social issues. So the Social Service Board is the nonprofit that's associated with the society. And we run different projects, like we have a women's shelter downstairs that we operate. We have a soccer league for children who are undocumented. We have a televisiting program, which I'm the director of. And televisiting connects children and teenagers with their incarcerated parent through telepresence. So we have a televisiting room that's in the office down the hall, which you'll all get to see. The children come there and they hang out with me or one of the interns, and mom beams in from Rikers Island or dad beams in, and they have a video visit together. So we've also started doing things that are a little more clinical with that, in terms of doing anger management interventions that combined both. In August, I went out to Rikers Island. I did a group of about 10 guys. We had an anger management group Monday, and then we did individual sessions through video. So it was a really interesting project where we did correctional facility-based, community-based, group format, individual format, on-site, and video-based. So there's a lot of really creative, interesting things that can be done. So that's, I wanted you to know about the Social Service Board and know why you're here, is because of largely the efforts of Dr. Phyllis Harrison Ross, and she's really committed to helping people learn about how to do mental health and how to do it in really interesting ways that address technological, clinical, and social issues. The other thing is on November 1st, Saturday, November 1st, in this building there's going to be a telepsychiatry panel and brunch. You're all invited. It gets cross-disciplinary people. Actually, one of the psychiatrist who completed the course last month, the course that you're in now, is going to be speaking about her experience. So that's going to be really interesting. Empowering Ethical Elders, you can pick up that at the back. It's free workshops for elders and people who work with them. So if you're interested in geropsychiatry or anything like that, it's a great thing, or if your patients are, or your colleagues. Grand Connections is the televisiting program. There's a brochure. We'll have plenty of time to talk about that individually if you're interested. Also, Sesame Street came out with, has anyone seen this yet? No? So Sesame Street came out with a series of kits on difficult topics for kids. Things like divorce, illness in the family, and incarceration. So this is the Incarceration Kit. It's a kit for children. And it features two characters. One is Jada, and Jada has green hair and... Nope, he has purple hair and a green nose and orange skin and pink eyeshadow. And his dad is incarcerated. And so it's a whole bunch of video clips about incarceration from a child's perspective. So if you work with any families who may be experiencing incarceration or have a history of it, or just want to know more about it, it's an excellent, excellent kit, and we have those for you at the back as well. I think that's all my sort of intros and give you some context about all the sort of creative, interesting things that go on and are going on, and that perhaps you'll be a part of. If you've demonstrated an interest in learning more about telepsychiatry and how that can be sort of leveraged to do interesting things. My background, I'm a clinical psychologist. I'm just really interested in technology and leveraging it to address clinical, social, and sort of intellectually interesting things. And so for me, telemental health, telepsychiatry, telepsychology and is really interesting, and especially working with folks who are removed or hard to reach, such as one of the projects we're going to be doing is working with the Jericho Project, which is a network of black churches in Brooklyn who are looking at doing consultations for telepsychiatry. So the idea of beaming into a church to be able to offer psychiatry services is a game changer. So these are some of the things that we'll be talking about, learning about. What we really want to do now is find out who's in the room so that we know, and also so you know each other. Because you guys are the second cohort going through this training, and it's the first time that we've ever done it, and it's a really big step that we can be making in terms of the New York City area, sort of retooling and educating folks in psychiatry about what is possible. So, start with.
I want to thank Dr. Phyllis Harrison Ross for getting Dr. Corriliano and I together here. She's been a guiding light for using technology, which is telepsychiatry, in advancing causes like helping people who are incarcerated in prisons connect with their families. And I guess her and Dr. Corriliano, along with the support and cooperation of our local district branch of the American Psychiatric Association. We have Hyler and is Megan here?
Megan is sick today.
Okay. Who have been helping us with the logistics and support for putting this all together. We want to thank them very much, or we wouldn't all be here. A couple words about myself. I've been involved in telepsychiatry since around year 2000 or so. My work in telepsych has been with the New York State Office of Mental Health and New York State Psychiatric Institute, where I coordinated the telepsychiatry consult service for New York State, where we connected with our host site, which was at the Psychiatric Institute, with rural community mental health centers all over the state, as well as the inpatient services in various state mental hospitals, and some of the maximum security, the mental health units in the maximum security prison system. So I was coordinating getting the patients connected with the specialists to do the consultations. And that was a real learning experience for me, and along the way I learned a lot about the technology, about the administrative aspects, and about the legal aspects of doing this stuff. I'll share some of those experiences with anecdotes as I go through my presentation. With that, you know a little bit about me. We're going to want to get to know a little bit about you, which is basically who you are, where you're working, and what brings you to this course, what your interests are, because between today and next week, we're going to try to cover most of your questions. So why don't we start in this corner and say it loud so everybody can hear who you are, where you work,